Women are the cornerstones of the family. We have to do everything we can to advocate women's health. This is the single most important thing you can do for yourself this year. Oftentimes we're, rushing to various sports events, teachers' conferences, just trying to make everything right and kind of hitting all the points of being a mom, working mom, a wife, a spouse, a partner. But what you really need to take away from this discussion is screening mammography. It's an hour a year, and it's going to be the most important appointment of your entire year. There's often a misconception that it's 45, 55, and there's so much controversy in today's medical literature. But I can't tell you how many 40th birthday celebrations I've been to, and I've been that friend. No one ever wants an oncologist at their birthday party. And oftentimes I say, well, it's time to get your screening mammogram. So I think if you can go out there, and if you have your first screening mammogram at 40, go out there, tell your other friend who's about to turn 40. So incredibly important every calendar year, starting at the age of 40 for average risk women. I see this all too often when a patient is diagnosed in the community. They're oftentimes given results over the phone. Perhaps by very caring radiologist or a gynecologist, and then after that it's like the clock starts ticking, and it's the onus is oftentimes on the patients. Like, find yourself a breast surgeon, find yourself an oncologist, find yourself a radiation doctor, and oftentimes patients are extremely overwhelmed. At New York Cancer and Blood, it's a multidisciplinary approach. We're going to help navigate. We're going to help get you plugged in. If you're seeing a medical oncologist, we're going to make sure that, you're seeing a breast surgeon, within a week, that you're meeting with a radiation oncologist. If your cancer is progressing, we're going to be doing a liquid biopsy to get a real-time perspective and actual information on what the cancer is doing, what mutations we can target, and what cutting-edge treatment options are available to you. In breast cancer, we have new oral therapies targeting the ESR1 mutation, the PIK3 mutation. So really just an exciting landscape in breast cancer at the present time. And I think one of the other most, amazing things that's come out of oncology and research over the last few years is this notion that women who have breast cancer can never have families. But what we know now is there's a lot of data supporting that following a breast cancer diagnosis, younger women can absolutely have fulfilling careers and end up having family and children. And I think that's just such an amazing thing. And I think as oncologists, it's our responsibility to tell our patients, yes, you can do everything that you want to do, and you can do it just as well as you did before your cancer diagnosis. What we want to do is we want to save people's lives. We want to, be their hero. We want, patients to see us for 10, 20, 30 years. And, that's a really exciting thing to do as a physician. Once you get into the nitty-gritty of being an oncologist, and certainly a breast oncologist, it turns into much more. These patients become your family. You see them season in, season out. Holidays come through. I've had patients who've shown me pictures of their kids graduating law school or college and saying, thank you for keeping me here for them, because they were in high school when I was diagnosed with metastatic breast cancer. So I think breast cancer advocacy comes from a true passion and love of the field. One of the stories that, kind of stands out in my head the most is a very good friend of mine. I treat her mother for triple negative breast cancer. She's doing wonderfully well now, several years out from her diagnosis, just thriving, enjoying life, enjoying her grandchildren. Kind of in discussing with her daughter, we talked about early screening. Her mother was extremely young when she was diagnosed with triple negative breast cancer, at the age of 42. So this particular patient, I sent her for a screening at 36 years old. And unfortunately, she was found to have calcifications, which led to an ultimate biopsy, all through New York Cancer and Blood, and with the guidance of Dr. Tobin and Dr. Safir. She had a wonderful experience, and she was diagnosed with stage 0 cancer of the breast. which subsequently led to surgery, genetic testing, and now I'm happy to report she is a year and a half cancer-free. And because of that, extra step, that extra mile that we went to offer her early screening when she probably would not have had breast imaging for another couple of years, led to early intervention and really saved her from needing more aggressive things like radiation and chemotherapy that could have taken her away from her children. When we detect these pre-cancer cells that could increase your risk of future cancer, or when we detect abnormal calcifications before they invade the duct or the lobule, we know that women can be offered surgery as a curative approach. We can then eliminate potentially the need for chemotherapy. In some instances, early detection can eliminate the need for aggressive courses of radiation, chemotherapy, and hopefully even prevent women from experiencing the long-term toxicity of what we're all scared of. And, that is getting intravenous chemotherapy or systemic therapies. So I think this is really why we're pushing for early detection and early diagnosis. We know, and what I tell my patients is, when they meet me, that I'm a member of your team. There's a couple of other faces you're going to meet, whether that's a radiation oncologist, a breast surgeon, a plastic surgeon. I think it's key that women know that there are multiple players, but that we're all cohesive. I had everyone's phone number, and at the end of the day, I would, make it a point to call all the surgeons who I knew were operating on my patients within the next couple of weeks. That's the extra step. That's the extra step you want your doctor to take. And that's what we do day in and day out. Our goal is to allow people to have full, complete, emotionally full lives that are not burdened by their cancer diagnosis. Even my patients who have advanced disease or metastatic breast cancer, as we call them, and who may remain on therapy for the rest of their lives, what I say to them is, I want you to come into the office or the clinic and get your infusion, once every 3 weeks. And then, between your visits with me, I want you to live your life. I want you to travel. What's the purpose of doing all these amazing treatments if you're not going to go out and live? So I think that's really our goal in, treating breast cancer, whether it's early stage, later stage, living a full life where you can do all the things that are meaningful to you.